This program has been brought to you by Durango Party Rental. We put it all together perfectly.
As hundreds of student athletes return for early training this August, San Juan Regional Medical Center wants coaches, athletic trainers, and parents to be aware of the dangers of concussion. More than 200 area coaches, their training staff, and local physicians attended a symposium last week on the signs and treatment of concussion among student athletes.
We think that it is vastly underrecognized, that because it's underrecognized and not treated properly, that our athletes are being exposed to unnecessary risk.
The Center for Disease Control reports that the incidence of concussion among athletes younger than 19 has reached epidemic proportions. More than 300,000 student athletes suffer from head injuries every year, and concussions account for nearly 15% of all high school sports injuries nationwide. LeCompte and her colleagues say they aren't out to eliminate contact sports for student athletes. They just want to see young athletes take time to heal after a concussion before returning to play.
So there's a lot of needs that are met by participating in athletics, and there's a lot of pressures on the athlete, him or herself, once they commit to doing this. Sometimes those pressures may overshadow what the needs of the basic needs of that athlete to take good care of their mind for injuries that they may not be able to that aren't visible.
Symposium physicians recommended that coaches immediately pull students from practice or a game when they take a hit to the head to avoid further damage from a second hit. If students sustain a concussion, they need to refrain from practice until their brains heal. But that doesn't mean ostracizing students from their teams. Isolation can be just as damaging as the injury itself.
The risks are depression, severe depression. Some kids revert to substance abuse to deal with the pain. And I would say maybe 5% of the student athletes that I take care of end up dropping out of school.
Waters recommends that coaches allow bench students to attend practices and to travel with the team to competitions. Most importantly, coaches and players need to watch out for each other.
Encouraging coaches and teammates to look after each other. So if you recognize somebody who might have a concussion, tell the coach, tell the nurse, and then when they're recovering, be there to support them.
The Center for Disease Control offers online informational and training materials on head injuries for parents, coaches, and student athletes. They can be found at cdc.gov.